Okay, dear Professor Korea, Professor Van Brecker, and Professor Sun, on behalf of Professor Shihua Zhao, I extend my greeting to you. Due to Professor Zhao being a candidate for the academician and unable to attend the Congress this year, I will present the content on his behalf. My name is Wenqin Xu, coming from Fuai Hospital Department of Radiology. Today, I will be presenting on the topic cardio MRI imaging mimicking pathology, clinical significance, and Chinese data. And here is a concise introduction about Professor Shihua Zhao. He is a tenure professor at Peking Union Medical College, academic commitment at Chinese Academy of Medical Science, and chief physician at Fuai Hospital. He has won the second prize of National Science and Technology Progress Award as a primary contributor, and he has long been dedicated to non-invasive assessment of cardio MRI and research in imaging artificial intelligence, with related study published in Nature Medicine, Circulation, and European Heart Journal as the corresponding authors. And the first part is the background. As we all know, there are various imaging modalities used in the assessment of cardiovascular disease, including echocardiography, CT, and cardio MRI. In clinical practice, echocardiography offers a quick and convenient way to evaluate cardiac function, and CT can provide detailed morphological parameters. But CMR as a non-invasive and multi-parametric imaging technique not only can capture functional and morphological changes, but also can provide tissue-level parameters, especially for cardiomyopathy. And we will always say that technology such as LGE and T1 mapping allow us to visualize historical changes involving myocardial cells and fibrosis. In summary, we will say that CMR is just like a conductor of the orchestra, and it can coordinating a wide range of cardiovascular parameters, including functional, morphological, and tissue level characteristics for the price diagnosis and risk stratification. And CMR is widely recognized as the gold standard for assessing cardiac structure and function. In multi-sequence and multi-parametric capabilities enable a comprehensive one-stop shop evaluation of the heart disease. In both acquired or congenital heart disease, CMR play a vital role, and it can quantifying ventricular function and detecting myocardial fibrosis and visualizing complex cardiac anatomy to guide diagnosis, treatment, and surgical decision making. For years, pathology was regarded as the gold standard for the diagnosis, but advancing CMR technology now enable in vivo tissue characterization and partly replacing traditional pathology. For example, LGE in CMR can detect myocardial fibrosis, and it not only quantify the extent of myocardial infarction, but also identify arrhythmogenic substrate. Moreover, a special LGE pattern corresponding different disease, just like the transmural LGE is always like the ischemic cardiovascular disease, and the infection part LGE pattern will more likely see in the hypertrophic cardiomyopathy, and the patchy-like LGE pattern will see the myocarditis. Additional techniques like T1 mapping, ECV, strain, and diffusion imaging can help us to detect early fibrosis change and mechanisms. And combined methods such as LGE with T2 or T2 star mapping, it can show the intramyocardial hemorrhage and offer a comprehensive view for acute myocardial injury. And Given to the unique ability of CMR to characterize the myocardial tissue non-invasively, is considered one of the most powerful tools for imaging-based pathological assessment. Professor Zhao Shihua has been a leading advocate for the concept of imaging pathology in CMR, and consistently voicing China's contribution on both national and international stage. The novel concept of image mimicking pathology, or we can say the Mandarin 影像病理化, was proposed the first time internationally in Science Bulletin, and this article will demonstrate that myocardial fibrosis is the core pathological basis of cardiovascular disease, and by using advanced cardiac MRI techniques, we have many tools like diffusion tensor imaging, feature checking imaging, T1 mapping, ECV, and T1 row mapping. This approach enabled the visualization of microscopic myocardial remodeling and the detection of subtle myocardial lesion that would otherwise only identified under a microscope. And the second part is fibrosis in vivo. This professional review coming from Nature Review Cardiology say that myocardial fibrosis is the common pathological basis of heart disease, and it's also the messy matrix. It's of great significance to detect myocardial fibrosis non-invasively in vivo, review the occurrence and development of myocardial fibrosis, and clarify its relation with the prognosis and risk stratification in the cardiovascular disease. And the classic circulation study showed that CMR with LGE can access the myocardial fibrosis in real time, in vivo, and non-invasively. And myocardial fibrosis detected by LGE was an independent predictor for MESI, and patient with great LGE extent has significant growth outcome. So we design our research protocol and systematically investigate myocardial fibrosis through 4 stages. And firstly, we will explore the fundamental mechanisms behind its development and evaluation by the basic research, and then we develop and validate innovative imaging techniques with a focus of CMR. We then apply these techniques in clinical setting to improve the diagnosis and prognosis in cardiovascular disease. And finally, we build disease risk prediction model by integrating clinical imaging big data with AI technology, aiming to transfer research finding into practical tool for patient care. And there are our basic research in the mechanism of myocardial fibrosis, and combining animal experiments with clinical studies to identify myocardial fibrosis, leading to life-threatening arrhythmias. And the experts say that is open the door for novel therapeutic approaches. This finding has published in Circulation and from Zhao's group, Wang Yihui. And our research focuses on myocardial fibrosis, beginning with the gene mutation and prognosing through the microstructure and macrostructure change. Using advanced imaging techniques such as strand T1 mapping, ECV, and DTI technology, we integrate multi-scale imaging data with clinical information, and ultimately, this approach added in clinical riskification enable precise classification into low and intermediate and high risk group. In conclusion, we focus on myocardial fibrosis and carry out a basic imaging and clinical full-chain research for cardiovascular disease. And for this approach, taking hypertrophic cardiomyopathy as an example, Our team analyzed 6,000 patients with HCM confirmed by CMR at 5 hospitals among 9 years. And among these cases, 77% for the classic asymmetric symptom hypertrophy type, and 20% with apical hypertrophic cardiomyopathy, and only 1.2% involve HCM with left ventricle apical aneurysm, highlighting the rarity of the subtype in Chinese population. And then, based on our database, we find apical hypertrophic cardiomyopathy with left ventricle apical aneurysm is very real condition, and this frequently missed by echocardiography, but is easily detected in CMR. Importantly, this subtype is associated with significant higher risk of adverse cardiovascular events, and this finding was published in EHGO Cardiovascular Imaging. And furthermore, based on the serious CMR follow-ups, we hypothesize that the apical aneurysm formation in apical HCM is a chronic and dynamic process involving structure and function change. The progression may follow a four-step pathway, starting with the systolic apical cavity obliteration, and then go into apical slit. After that, it will becoming an apical outpunction, and finally becoming the apical aneurysm. And this is the example of our hospital to show the fourth stage in the HCM, in the apical HCM. And the first time is the obliteration, and then is the apical slit. Then we can see there has the outpunching of the left ventricle. And finally, it is becoming a ventricle aneurysm in left ventricle. And given the prognosis value of extensive LGE has broadly recognized, we also find the subendocardial involvement LGE subtype of HCM. And this type of LGE is an unrecognized LGE pattern, show the potential to improve risk stratification in HCM patients with no extensive LGE. And this finding is published in JACC Imaging. And in vivo visualization of myocardial necrosis and fibrosis characteristic in patients with the giant cell myocarditis, compared with the pathological studies, reveal that a new phenotype of abnormal subendocardial fibrosis in myocarditis, and this finding is published in Radiology. And then we used the large HCM cohort to refine the international guidance model and propose the new schedule of SCD risk stratification. And we find that patients with intermediate risk in the 5 to 50% LGE range have a 6-fold higher risk of SCD compared to low-risk patients. And the next one is AI. We also developed a series of AI prognosis model and built a novel HCM risk prediction model incorporating advanced CMR parameters, and including the strain and LGE extent, using the machine learning to quantify the non-linear relationship between the CMR parameters and outcome. We will find that this machine learning model performance is better than traditional tools, and external validation show that its effectiveness is 23% higher than the international traditional model. And then we built the first end-to-end deep learning imaging genetic association model in HCM, and directly predict the mutation from the raw DNA sequence. And it also has a higher effectiveness to predicting HCM gene mutation risk. And this finding is published in European Radiology. And at last, we promote the development of intelligent medicine in CMR, and they have three major challenges for clinical adoption of CMR. The first one is the scan has a long scanning time and have multiple imaging sequence and have long CMR physicians training is really long, have a long period to training the professional doctor to look at the CMR imagings. So to address the major limitation in the clinical application of CMR, our team developed an AI-powered auto-diagnosis model based on deep learning, and we collect about 10,000 CMR patients to build this deep learning model, and we find that it can achieving classification and diagnosis of 11 types of cardiovascular disease with an accuracy of 93%, and the diagnosis time per 500% reduced from 418 minutes to 2 minutes. And this paper has published in Nature Medicine. So the last one is our research team, and Professor Zhao Shihua has published over 300 papers as the first order or corresponding order, including 113 essay papers. And as the corresponding order, he also published many papers in renowned journals, including Nature Medicine, Circulation, European Heart Journal, Radiology, and 6 papers in JACC Cardiovascular Imaging. He also awarded the National Science and Technology Progress in Award in 2019. And finally, is that this work represents a collective effort by our team to continuously overcome the key challenge in CMR imaging. Through persistent innovation and collaboration, we have not only advanced the field of CMR, but also proud to contribute a strong voice from China to the international stage. And thank you very much.